Hello, my name is Brianka Larkin, and I will be doing my ER transfer report for the physician. So, this patient is a 20-year-old male. He's a college basketball player. He has no past medical history or any allergies. So, this patient presented to the clinic today with complaints of nausea, vomiting, diarrhea, and poor appetite times 2 days. And today, he said what really brought him in was that he had a sudden abdominal pain that started at his navel and radiated to his right lower quadrant. The patient states the pain worsens when he walks or makes any type of sudden movement. Upon arrival to the clinic, the patient did have a temp of 100.4 and his heart rate was 99. Respirations were 18. Blood pressure was 131/75 and he was 99% on room air. During my assessment, I first inspected the patient's abdomen and saw that there were no abnormalities. I listened to his bowel sounds and they were decreased. I gently palpated the patient's abdomen and he was positive for the McBurney sign, Bloomberg sign, and Dumfries sign. The patient states the pain is dull and cramping feeling, and the patient rates the pain at a 10 out of 10. Some diagnostic tests that we did in the clinic was that we got a UA to rule out a UTI and any other urinary issues. The UA was negative for any issues. And we also gave the patient some Tylenol for his low-grade temp and to kind of help with pain. The assumed diagnosis for this patient is acute appendicitis due to the patient presenting symptoms of nausea, vomiting, diarrhea, and poor appetite for 2 days, and the sudden onset of abdominal pain that started at his navel and radiated to his lower right quadrant. Also, his low-grade temp of 100.4. Also, another reason for the diagnosis of appendicitis is because of the positive McBurney's, Bloomberg, and Dumfries signs. The patient appears to be in a stable condition. The patient can voice his or her needs. The patient has no signs or symptom of bleeding or any signs or symptoms of peritonitis. The contributing factors or potential contributing factors include a virus, bacteria, or parasites in the digestive tract, a blockage in the lining of the appendix that could result in an infection or trapped stool, or a type of neoplasm that could cause the appendix to become inflamed or swollen. My plan is to have this patient transported to the ER via EMS due to the possible diagnosis of appendicitis, which is a medical emergency. I will discuss the plan with the patient and let the patient know that the safest mode of transportation for him would be via EMS, just in case his condition changed. EMS would be able to treat the patient as needed. Thank you.